Essential Self-Care Podcast, a podcast for those of us who are, let's face it, too busy for self-care. In this podcast, you will hear real life stories from people who leaned into their self-care as they were navigating life's storms. You'll learn practical tips, tools, and strategies to incorporate self-care into your own busy life as well. You'll hear from expert guests sharing their expertise on specific tools and modalities of self-care to optimize your well-being in your life, career, and relationships. I'm your host, Dr. Sheetal Ajmani. I am a physician, best-selling author, and founder of Radiant Living Institute, where I guide high-achieving women to get unstuck and learn to live radiantly again through major life transitions. This show is sponsored by Reclaim Your Radiance, Radiant Living Institute's signature coaching program designed to help you reclaim your worth, renew your energy, and restore your happiness in your life, career, and relationships. This program has already helped countless women navigate major life changes, from identifying that they were in toxic marriages and finding their way out, to finding their dream job, and to rediscovering their sense of inner joy, happiness, peace, and calm that resides within them all the time. So to get started, head over to radiantlivinginstitute.com. Quick disclaimer before we dive into the episode. Please know that this podcast is for educational purposes only and is not medical advice. Always seek the advice of your own health practitioner or mental health provider for your specific situation. Now, let's get started. I have the pleasure of welcoming Dr. Jimmy Henry to the Essential Self-Care Podcast. Dr. Henry is a well-accomplished physician, naturopath, and coach. He served in private practice as a physical medicine physician for over 10 years before transitioning to become a board-certified naturopathic doctor and certified coach, where he now helps physicians and other professionals resolve their stress and help with weight issues to improve their overall health and wellness. Today, Dr. Henry is going to share a bit about his personal self-care journey and the tools that he found most powerful along the way. Welcome to the Essential Self-Care Podcast, Dr. Henry.
My goodness, thank you so much for having me, Dr. Shito. I really appreciate you inviting me on, and the great introduction. Thank you so much for that. But my journey is pretty interesting, so I'm looking forward to sharing it with you.
Me too. I'm really looking forward to this conversation. You know, Dr. Henry and I connected initially just a few months ago, and we had a really great conversation. And we both had shared a little bit about our self-care journeys during that conversation. So I'm excited to share a little bit more about your journey and specifically the tools that helped you the most with our listeners today. So can you tell us a little bit about a time in your life when self-care became no longer an option for you, but an absolute necessity? And most importantly, what tools you turned to at that time?
Yeah. So my wellness journey kind of began back in 2014 when, unfortunately, my cousin passed at a young age of breast cancer, and I realized that she had no risk factors. I realized that I needed to kind of change my life a bit to try to avoid any potential health concerns. But at that time, I was still working as a busy interventional pain management doctor, busy practice, just very overwhelming, and didn't have the opportunity to really dedicate myself to my self-care like I should have. Fast forward to 2020, when it was a tough year for everybody, right? We had the pandemic, we had there was racial conflict around the world. I actually left medicine in 2020. I left the relationship in 2020. So at that time, all these things were kind of converging on me. And that was really when I took a step back and said, I don't have any other choice but to prioritize myself. Otherwise, I wouldn't be able to stay in a good place, really. So what I turned to, the first thing I turned to was my faith, and really diving into spirituality helped me immensely. The second thing I did, I turned to therapy. And sometimes people feel like you can't do both, but I'm here to tell you that you can have faith and therapy at the same time. And that combination really took me to where I wanted to be. and now where I'm helping people get to where I am at now.
Absolutely. Thank you so much
Yeah,
for sharing. And I
yeah,
hear a few things that I want to reflect upon
sure.
before we dive even deeper here. But one is, it sounds like in 2014, with what you saw and witnessed your cousin experience,
Yeah,
and her loss, that really increased this self-awareness within yourself. And but then it was really not until 2020 that it really kind of all came into putting it into action a bit more,
mhm,
with
right.
a sort of constellation of things that went on, obviously with the pandemic. And, you said you left medicine at that time, a relationship. So a lot of different things coming
Right.
together at that time that really fueled and prompted your self-care journey to dive deeper. So although that awareness kind of set in a few years earlier, really kind of dived deeper into that in 2020. And the first two tools and primary tools that you turned to was your faith and spirituality, as well as therapy. And I love that you mentioned that both can exist at the same time.
Exactly, exactly.
I think that "and" is always such a powerful word, because I think so
Mhm.
often we think that we can only do, one thing or another. Or, I specifically use this word "and" often also when we're talking about our emotions, that we can experience different emotions at the same time. It doesn't have to be like one
Yes.
or the other. That "and" is a really powerful word. So I love how you shared that as well. Can you share a little bit more about those tools specifically and how they helped you?
Well, therapy really taught me to practice self care. And I love the name of your podcast because self care is really essential. And
Mhm.
one thing as physicians, we're actually conditioned to neglect ourselves, sacrifice ourselves to help others, right? And that's deemed noble, but it's actually self destructive behavior. And I actually have a kind of personality trait that actually plays into that as well. So my therapist would actually suggest to me, she wouldn't call it self-care, but she would say, do something for yourself, whether it could be just going for a walk, it could be going to get a haircut, it could be going to the gym, right? Anything that you're actually prioritizing yourself first, I consider it to be self-care. And that was something that I had to really practice. For being a physician, being a dad, you have all these other um, seemingly urgent things that you put before yourself, and meanwhile you're actually losing yourself in the process. So that was really big for me to actually practice that discipline of doing things for myself.
Yeah, absolutely. And
Yeah.
you bring up a really good point, that as physicians specifically within our industry, we're just conditioned from very early on in our training to not take care of ourselves. There's this sense of like just martyrdom, which I feel like is starting to change with um people like yourself and myself, and many of our colleagues now, who are also starting to realize the toll that it takes, and that many of us are starting to bring awareness to these issues. For so long it has been just really conditioned into our training that, almost looked down upon, even to call out sick when you're legitimately sick.
Right,
Like,
right,
not
right.
to mention not to mention, your mental wellness, right? That's
Exactly,
just
exactly.
and so that's so important, and it's such a because we've been conditioned in that way for so long, both within our training as well as, like you mentioned, many of us, just simply by nature of who enters the medical field, like many of us may have
Exactly.
certain personality traits that tend
Right,
towards
right.
that already as well, toward just continuing to drive ourselves, and neglect our own uh, self-care and our own needs. Um, and that's, I think, any of these professions that are healing professions, nurturing professions, right? I love that your therapist really kind of brought your attention and your awareness to that. And it reminded me actually of, um, I love that your therapist really kind of brought your attention and your awareness to that. And it reminded me actually of, um, a time when I was going through a major transition in my life as well, with regards to a relationship. And the first thing that the therapist that I was seeing at that time always asked me every single session is, what are 3 things you did for yourself in the past week?
You're right.
Every single session started that way, and so I knew that that was how every session started, and so that I had to have 3 things that I
Exactly,
could share
exactly.
with her that I did for myself. So I love that you shared that as part of your journey as well. And then let's dive into a little bit about faith and spirituality. That's certainly played a big role in my journey as well, and I would love to hear your journey with the role that that played as well.
The funny thing is, the irony is, the more kind of difficulties I went through, actually, the more my faith increased, actually strengthened my faith. And one main thing I want to say is that as physicians, we oftentimes tie our identity to what we do. But once you remove yourself from that and align your identity with your faith, it becomes more of a long lasting proposition, right? Because your career can come and go. And a lot of us, when we are conflicted with, okay, what do we do? I'm in medicine, I'm not loving it anymore, but my identity is here. So what do I do? So really, faith helped me remove myself out of my career and into my higher purpose, right? And I think that really propelled me for it allowed me to actually walk through any difficulties with peace. Because again, there's a greater good that's occurring, even though it may not feel good at the time. Um, so really faith really helped me get through some of my darkest moments, but gave me this insight to, okay, how do I align my identity and myself to God's will for me. And and so what it looks like now for me is serving people, helping still, but just in a different way, in a less self-destructive way, really, and in a way that I can sustain for a longer period of time.
Absolutely. In a way that feels
Yeah,
aligned to you and who you are at the
correct.
core. And I think that's really powerful what you shared. So many of us, we tend to identify with something in our life. Often it's a career or a relationship, something external to us, right? And we can
Correct.
um, attach so much of our sense of who we are and our identity to that external thing. And
Right.
certainly as physicians, we have many of us have spent a really good portion of our life studying to become a physician, in training, 25 plus years to just get to the
Mhm.
point of even being able to practice as a physician. And so much of your identity can be wrapped up in that. And so really acknowledging and finding that, you know, who are you outside of that as well, right? Whether you
Right.
continue to practice medicine or not, right? I think that's important for any of us, and regardless of what career you're in, and whether you continue to choose to follow that path or pivot in some way, really taking that time to look within. And that's also a big part of, I always say a radiant life starts from within, right? So
Yeah.
taking that
Yeah.
time to
Yeah.
connect with your highest self, whatever you call that, whatever, whether you believe in God, the universe, whatever it may be, but taking a moment to connect with that highest self, your inner voice, and allowing yourself to align with that and move
Right.
forward from that place. So I love that, and I love that you shared that part of your journey as well. I'm curious now, how has this journey that you have gone on now influenced, because this was all started in 2020. So how has
Right.
that
Right.
influenced kind of where you are now as of the time of this recording, and kind of where you are in your
Yeah.
journey now?
Exactly. So the last, few years, I've really grown just as a person, as a man, I've always been present, but now I feel more present as a father. Becoming certified as a naturopathic doctor, a coach. I'm also a minister. So all these different components really now shape who I am. and helps with the clients that I now serve. Um, so I help them become more aligned, with themselves and with their faith. I help them transform their mindset. Renewing your mindset helps you actually transform your body. Help them focus on exercise and nutrition. So that spells out amen. So that's kind of my framework in my coaching. I address those four pillars of wellness to um, help them improve their wellness and make their body their actual temple, and helps them really, whether it's in family, career, general life, become better versions of themselves.
I love that, and so I want you to share that again, please.
Yeah,
So
sure.
so you
Yeah,
did mention that you, have also become a minister, recently.
yeah,
I've been, obviously
yeah,
following along on, your posts on Instagram and LinkedIn.
yeah,
Of
yeah,
course, I'll drop those links in the show notes, but I really love seeing, even just from the first conversation that you and I had a couple months ago, when we were first just introducing each other and getting to know each
yeah.
other, of even from then to now, of just kind of seeing how that has really evolved in your the messaging that I've been seeing in your social
Mhm.
media presence, of really just tying together all of these different pieces that have been so meaningful and impactful for you as well, and that I know will help so many others as well. But I love these acronyms. I have an acronym with my program too. I can share that after you share yours once again. But can you just go over that again? The acronym is AMEN, and so just
Yeah,
go over what
yeah.
that stands for again.
Sure, yeah. So, amen, right? So, A stands for alignment, right? So, aligning our purpose with God's will for us. And in our wellness journey, a lot of people's why is not strong enough, so they can't sustain their wellness. But when your why is tied to God, it is, right? So, M stands for mindset. So, renewing your mind in order to transform your body. Prescriptive as opposed to preventative. So I really help people transform the way that they think about their health. Exercise is E, and that could look like mental fitness, physical fitness. I help people actually develop something that they can consistently do and stick with. And then nutrition, obviously, is N, right? So what do you feed yourself? What using food as fuel, which is its main purpose, right? As opposed to emotionally eating or what have you. So really being mindful about what you eat and why you eat it. And I think those four pillars have really it helped transform me. And I didn't develop it; God kind of gave it to me, and I've been helping people using that same frame framework.
I love that. I love that. And
Yeah,
just so easy to remember with that acronym. And I see
yeah, it
so
is.
many parallels and just some similarities with a bit of my method as well. And I think that's, why we're so aligned here. And
Exactly.
so I want to share some of that too. So, the acronym that I use for my uh, method is CAR. So to get from where you want to be to where you want to, from where you are now to where you want to go. I
Yeah,
recommend that you use a car as your vehicle, where C stands for clarity, A stands for acceptance, and R stands for rebuilding. And then
yeah,
within that, clarity is about, kind of taking inventory of creating your life vision, that sort of thing, creating empowering daily routines. So again, aligning your daily routines.
yeah,
And then under acceptance, I have it about cultivating the mind body connection, which I see that in your method as well, with the exercise and the nutrition and the mindset. And so for my process, I guide people to mindful movement practices and mindful eating practices.
Mhm.
As you said, kind of, the food that we eat, it fuels our body, but also thinking
Right.
about it, it's how are we nourishing and feeding our body, our mind, emotions, all of that together. And then under
Right.
rebuilding, I have setting boundaries to create that work life balance, and then taking time to celebrate. And a big part of all of that, one thing that I always talk about, I love that word alignment, and I love that that's part of your method too,
Yeah.
because it's something I really emphasize also, is that so often we're looking for some sense of balance in our life.
Right.
But
Right.
I like to think of it more as alignment, because life is always changing, right? Like,
Right. Right.
you and I both know, our listeners know, that life is constantly putting challenges and difficulties um, on our path. And I truly don't believe that that's meant to make us suffer and be miserable. I truly believe that it is to help us grow and learn more about ourselves and heal and in some ways, maybe be able to serve others through that as well, like you and I are both
Right,
doing
right.
by using our own journeys in this way. But I really think that this word alignment helps us to see that it's not about trying to find some elusive balance where everything is 50-50 or whatever proportions you want it to
Yeah,
be,
right, right.
but about how can you kind of flow through all these changes in life while still maintaining alignment with your highest self and your highest purpose.
Exactly,
So I
exactly.
love
Right. It's hard to live life perfectly balanced, right? Because things you're juggling so many things at the same time. But once you feel like you're aligned with your purpose and you have a goal, no matter what's going on around you, you can still move forward, right? It may not be a perfectly straight line, but you still feel aligned with your purpose. So I definitely love that. There's so many similarities between us that we can, collaborate here.
Oh, absolutely, absolutely, and I feel like we could keep this conversation going on for
I
so much
know, right?
longer, so we'll just have to have you back on the show
Yeah,
again in the
exactly.
future, but in the meantime, as we wrap up this episode, I'm sure our listeners would love to learn more about where they can learn more about you, the work that you're doing. I mentioned your Instagram and
Mhm.
LinkedIn, so
Yeah, yeah,
definitely
exactly.
listeners follow him there, follow Dr. Henry there, but where can they find more about you and the work that you're doing?
Yeah, so my website is drwellfit.com, Dr. DOCTOR, Wellfit, WELLFIT.com. And my handle is Dr. Wellfit at Instagram, LinkedIn, TikTok, YouTube, all same handle.
Wonderful. And I will include those
Yes.
links in the show notes. Thank you again for being here and for sharing your journey with us today.
Thank you so much for having me.
Thanks for tuning in to this episode of the Essential Self Care Podcast. If you like what you heard, be sure to subscribe, leave a positive review, and share this episode with someone you know. And remember, your free guide, 6 simple yet powerful steps to create your radiant life, is waiting for you at radiantlivinginstitute.com. Download it today.